Hello, my name is Rachel Leong, and this is our study on a retrospective evaluation on increased electrolyte supplementation and resolution of refeeding syndrome completed at Emory University Hospital in Atlanta, Georgia. My team and I have nothing to disclose. I'd like to start off with some background. Typically, malnutrition will worsen prognosis and quality of life, reducing the response to treatment and leading to extended hospital stays. In conjunction, refeeding syndrome is defined by the drastic and potentially fatal shifts in fluid and electrolytes when these moderately to severely malnourished patients are admitted and first receive oral, enteral, and/or parenteral nutrition on admission. The typical hallmark sign of refeeding syndrome is hypophosphatemia. This can be seen along with other electrolyte abnormalities such as hypokalemia and hypomagnesemia. In turn, this can lead to a wide variety of complications, including cardiac failure, dehydration, or fluid overload, hypotension, renal failure, and sudden death. Refeeding can last up to 10 to 14 days if the recommended practice for calorie titration is used over that 7 to 10 day time frame. The purpose of this study is to determine the resolution of refeeding syndrome by identifying the number of days with increased phosphorus utilization after initiating patients on parenteral nutrition. In terms of our methods for the study, this was a retrospective chart review. This included patients greater than or equal to 18 years of age, started on parenteral nutrition for the first time during their hospital admission at Emory University Hospital from September 1st, 2020 to October 31st, 2021. Our exclusion criteria for the study included patients with renal dysfunction, diabetic ketoacidosis, any genetic disorders, terminal conditions, if they were receiving home PN prior to admission, a parathyroidectomy, and/or hepatic lobectomy. Patients must have been on parenteral nutrition without any oral or enteral feeding for a minimum of 7 days. PN calories and dextrose content were not titrated during initiation in our practice at Emory University. In terms of our results, our first table in blue looks at the characteristics of our patients separated by the patient's refeeding risk. So if they had no refeeding risk, moderate, or severe. There were 13 with no refeeding risk, 52 with moderate, and 35 with severe. Included are the mean ages. Majority patients were male. Included is ethnicity as well. Looking at BMI in comparison with no versus severe refeeding risk, the patients with severe had that lower BMI. And looking at length of stay, patients with severe refeeding risk had a longer length of stay compared to patients with no or moderate risk. In terms of our primary objective of the study, we looked at the number of days with increased phosphorus utilization after starting PN. So we compared it to the FASPEN 2020 recommendations for daily requirement of 40 millimoles of phos per day. So on day 0, you can see the majority of patients require that higher amount of phosphorus, and then it starts to decrease back down around day 7. For our secondary objectives, we looked at safety by the occurrences of hypophosphatemia and hypokalemia. On the x-axis is days, and y-axis is the number of occurrences of either hypophosphatemia or hypokalemia. Reference levels are included below as well. And so for hypophosphatemia, you can see that there were no severe levels of hypophosphatemia, with a majority being mild and some moderate cases. For hypokalemia, again, very similar results with no severe levels of low potassium, but majority being mild or moderate. In conclusion, full calories can be safely provided in parenteral nutrition on day 1 with aggressive electrolyte supplementation. Overall, refeeding resolved in 92% of the patients by day 7. This shows that the full calorie approach can potentially shorten length of stay by greater than or equal to 3 days when compared to that traditional calorie titration approach for patients requiring home parenteral nutrition. In terms of limitations, this was a relatively small sample size, and I've included my references below. Thank you so much.